And so this conference is nice for us to get together and learn and exchange information, but there's a greater purpose. And that greater purpose is that we exchange this information in the hopes that we change things. And what's happening right now around the country is that we're beginning to realize that the things that we learn at the bench, basic science, in the lab, in test tubes, genetics, are not getting to the community, and they're not getting to the country to the level that it's changing public health outcomes. We looked at the cancer rates. For every 100,000 people that live in South LA, okay, there's about 210 cancer deaths. There's 1.1 million people, what Ms. Jones just told us there, okay? And compared to the rest of LA, there's only 160 deaths per 100,000. Because that's 500 people a year. That excess deaths just in South LA compared to the rest of Los Angeles. Okay, so part of this effort is how do we begin to make a difference and bring together the resources of everybody that's in this room. Okay, because we have a lot of different resources and relationships to try to make that difference. Okay.
Men cannot get breast cancer.
That's true. You're not supposed to
True or false? One is true, number two is false. Okay, let's see what they had to say.
Okay, so that's good, but not great, because there's still 8% of the people that thought that they can't. Maybe we weren't here earlier, but we had, the two breast doctors, well, the breast surgeon and the radiologist talk to us about that. Men can get breast cancer, and so if you're a male and you have an abnormal lump or mass, or there's discharge coming from your nipple, you need to see a doctor, okay? And men can get treated and can be cured.
Okay, when racial or ethnic group of women has the highest incidence number of new cases of cancer of the cervix.
Okay, so cervical cancer, that's in the women's vaginal area, okay? And that's a cancer that we check with pap smears.
Number
Okay, so
one,
when women get their pap smears, we're looking for cervical cancer.
African American.
Oh,
Number
sorry.
two, Asian Pacific Islanders. Number three, Latinos or Hispanics. Number four, American Native Indians or Alaskans. And number five, white. Which racial or ethnic group of women has the highest incidence, number of new cases of cancer of the cervix? I didn't say breast cancer, I said cancer of the cervix. Uh-oh. A lot of people didn't hear the information.
Actually, Hispanic and Latino women, okay, have the highest incidence of cervical cancer in the country as well as in Los Angeles, okay? And it's important to know because cervical cancer is one of those cancers in which we can do the best in detecting early, okay? We can prevent cervical cancer by getting the vaccine, okay? If you're under 26, between 12 and 26, young girls can get the vaccine that will help reduce your chance of getting it, and now we're actually giving it to young boys as well. If you get a pap smear, okay, a vaginal exam by the doctor with the speculum. I know it's not something people like to think about, but we can actually find out if those cells are abnormal or if you've been exposed to a virus called the human papilloma or virus. I think that's another question. That being said, we can detect it early that way, and if we find it, we can actually get you treated before it can ever hurt you. Fortunately, we do a good job of it, but it's a cancer that many women never have to get. And yes, Latino women in Los Angeles and in the country are the most likely to get that.
What racial or ethnic group of women has the highest incidence number of new cases of breast cancer?
Okay.
Number one, African Americans. Number two, Asian American or Pacific Islanders. Number three, Hispanics or Latinos. Number four, American Indians or Alaskans. And number five, the Caucasian or white community.
Dr. Maynard did talk about this.
So let's take and go 7, 6, 5, 4, 3, 2, 1. Answer, please. Okay.
Close, but no
But
cigar.
no one
cigar.
can win here.
No, we didn't win here. So white women are the highest, most likely, and have the highest incidence of breast cancer in the country. So compared to other groups, white women get breast cancer more than any other group. Dr. Maynard said that today. I know a lot of people are confused. But incidence means the number of new cases every year. So if you look across the groups, more white women get breast cancer than any other group. Next question.
What racial or ethnic group of women has the highest mortality? That's the death rate due to breast cancer. That means that that's right, someone said they died. Get it into it now.
Dr. Maynard brought that point up, and that although white women get breast cancer more than any other group, black women die from it more, okay? And so some of that has to do with getting more aggressive cancers, so a higher rate of the triple negative breast cancers, in other words, those that don't have any biomarkers on it. Okay, so triple negative breast cancers are higher in African American women. There's some slides that we'll show you a little bit later about access to care and delayed presentation. And African American women be more likely to show up in later stages of disease. Okay, so there are things that are partially about the tumor variation, but also partially to do with things like who they show up with. And then some of the new research and some of the things that we're actually starting to find out about things like the linkages between obesity and breast cancer and how that might actually affect higher rates of black women.